34. Okay. We have here our learning outcomes for lower GI disorders we're looking at now. So identifying signs and symptoms, therapeutic measures, pathotherapeutic measures, all those. What? Sorry about that. Okay. Plan care for teaching for patients with absorption disorders. This is kind of talking to you about what are in your learning outcomes. So you can read through those. I'm just going to go through them. You stop them where you need to. This is your lower GI system that we're focusing on in chapter 34. Constipation. You have dealt a lot with constipation in the hospital with your patients. We've talked about constipation a lot. Constipation, nausea, vomiting, all kind of goes hand in hand. We see a lot of that. It can be from different disease process, from medications, from all different types of things. Fecal mass held in the rectum. Okay, we want to give high fiber diet, fluids, and exercise. Not everybody can have that. That's why they have constipation, possibly. Okay, obstipation, prolonged constipation, right? Some people have that for quite some time. It can cause hemorrhoids and different other issues. What do we see? Abdominal pain, distension. This is stuff you guys are familiar with. Look at this, review it. I'm not going to spend a lot of time. We have 96 slides here. Therapeutic interventions, high fiber diet. Okay. Establish rapport, determine history, auscultate bowel sounds, inspect and palpate. Okay. Diarrhea is constipation's friend. You can cause diarrhea from trying to correct the constipation. Fecal matter passes rapidly. We can see, I'm going to again go through this fairly quickly. Signs and symptoms. Therapeutic interventions here. What do we want to do? We have medications, probiotics, right? Diarrhea, risk for fluid deficit disorder, blood volume. The nursing diagnosis, that's a serious one, obviously, fluid deficit, or risk for deficit fluid volume, because it's going to be electrolyte imbalance when you're losing a large volume of fluid. That can happen. Deficit knowledge, are they using the same foods, medications, whatever it is that's causing the problem? Appendicitis, okay, inflammation of the appendix. We see this commonly as well. Fever, nausea, vomiting, anorexia. This is a very distinct right lower quadrant pain in the abdomen that they will identify as their pain source, McBurney Point, that you can give you a good indication that it's a possible appendicitis. What are we going to do? CBCs, ultrasounds, CTs, MRIs, all of those are going to give us pictures. Okay, you see that there? It's a perfect diagram for the McBurney Point. That's where they're going to be saying they have pain for appendicitis. Nothing by mouth, they're going to have surgery to correct it. Okay, complications, they can have abscess, peritonitis, inflammation, infection of the peritoneum. This is also pretty common. Ruptured appendix you can have, so it's going to be an infection that's happened because the appendix has ruptured. Pancreatitis, diverticulitis, very painful. Signs and symptoms, abdominal pain, abdominal rigidity, nausea, vomiting, fever. It's infection. They can have fecal matter in there just loose, so obviously it's quite serious. You want to check white blood cell count, CT, MRIs. Exploratory surgery might be necessary. Okay, so we want to have the MPO, fluid electrolyte replacement. Again, this is something very serious. Top of our list, antibiotics, pain management after surgery. Complications, intestinal obstruction, hypovolemia, sepsis. Diverticulum, outpouching of the bowel mucous membrane, diverticulosis, multiple diverticula, and diverticulitis is inflammation of the infection of the diverticulum. These are all in your, along with what we've already covered. I'm up to page 664. Follow along in your text. Stop the slide where you need to. Table 34.3 is what's up. It's a acronym for symptoms associated with diverticulitis. Very good. It's on 665. Very good tool to help you to make sure that you have, and this gives illustrations of all what you need to know about that. This is the illustration here. Okay, so the diverticula are outside. We have causes: chronic constipation, decreased intake of dietary fiber, low fiber and high animal fat, obesity, sedentary lifestyle, smoking, medications. Okay. What are signs and symptoms? It can go from no signs and symptoms to just constipation or possible diarrhea. You can have either or. Cramping, bleeding, abdominal tenderness. Therapeutic, if it's mild, you can do Tylenol, antibiotics, liquid diet. If it's severe, it's going to be more involved with pain control, medications, which cause constipation, NPO, IV antibiotics, IV fluids, and surgery. Okay, this is for inflammatory or infectious disorders, acute pain, risk for fluid deficit. Okay, Crohn's disease. We are on page 666. Look at the, this is an autoimmune inflammatory bowel disease. It is generally seen in families, so hereditary. You can have hills and valleys, so remission and exacerbations, right? You have when it's, I forgot the word, but when it's active, it will be quite miserable. The patient will be quite miserable. We see abdominal pain, cramping, weight loss, diarrhea, fluid and electrolyte imbalance, very serious. These are the tests you're going to look at. My interventions, therapeutic, are medications. So this is what you are going to expect to see for medications. We want to avoid offending foods. So what for them is a trigger? People generally know. Spicy foods, fatty foods, usually small, frequent meals, less processed, more fresh. Those are going to be the types of food. Maybe not meats, maybe just more lighter, maybe no carbs, just like vegetables, light meats like small portions. Maybe chicken and fish go down better. Supporting education. Okay, what kind of complications? You see here what the complications are. Fistula. Okay, so these are fistulas that are highlighted here in the black circles in different areas. Ulcerative colitis. Okay, as well. They can come in remission, go into remission, and then have exacerbations, flares. Flares is what I'm trying to say. So if they're having a flare-up, they're going to, it can be infection, allergy, autoimmune response. Possible causes can be from something else in the body happening that causes the ulcerative colitis to come and have a flare. Abdominal pain. This is 5 to 10 liquid stools daily. It's quite noticeable. There's like commercial, you see the guy, he's like can't go anywhere, do anything, or the lady, and because they have to go to the bathroom constantly, and who wants to have liquid stools when you're out at a baseball game trying to have fun doing anything? So fecal urgency, anorexia, you need to be close to home, close to your bathroom, close to comfort. Weight loss, cramping, vomiting, all these things here. Complications, okay. Diagnostic tests, CBC, stool specimens, electrolytes. Okay, these are what you're going to see for ulcerative colitis. Therapeutic interventions, medications, offending foods, necessary surgery if necessary. Okay, nursing diagnosis possibilities here are acute pain, diarrhea, fluid deficit disorders, anxieties, impaired skin integrity. Yes, because that's very acidic, the diarrhea. Ineffective nutrition, less than body requirements. So, yes. Irritable Bowel Syndrome, or IBS, quite commonly known. Let me find this. It is on page 670 in your book. You can have IBS with diarrhea. You can have IBS with constipation. Or it can be mixed. It's not very fun. Etiology, more common in women. It can be hereditary. Bowel nerves, more sensitive. So triggers, it can be psychological stress again, food intolerances, infection, menstruation. Kind of some of the things that are all are common with these GI disorders. We see these types of signs and symptoms. These are the tests. We need to get a very good history to find out what are your triggers. Physical examination, colonoscopy, those types of things. Let's see. Therapeutic interventions. You're going to see, and the FODMAP diet is on page 672 under therapeutic measures. Look at all of these. Medications, IBS with constipation, selective serotonin. Okay, so these are what types of medications are. Paxil, Prozac can be helpful for this. Increase fluid secretions into the bowel. IBS with diarrhea is a little bit different medication. This is your nursing diagnosis options. Abdominal hernias, page 673. There's an illustration that will come up here. So it's a weakness in the abdominal wall, increased intra-abdominal pressure, and a protrusion will happen. So if it's severe enough, or else you just feel like a mass under there. And this is the illustration I was talking about that you can see. Okay, these are the signs and symptoms, your complications. Strangulated, right? It can get strangulated, and it can then cause ischemic death to the nerve endings, and that has to have surgery. Education, no coughing or lifting. Any kind of trauma is going to cause a protrusion to come back out. So support garments, those types of things are going to be really helpful. You can't lift anything, limited activities. Absorption disorders. Okay, let's talk about absorption disorders. Celiac disease, lactose intolerance. You guys have all heard about these. Weight loss, weakness, general malaise. Okay, this is all stuff you are somewhat familiar with. Diet change primarily is going to help here. Good diet. Diarrhea is going to be very helpful. Intestinal obstruction is on page 675. Flow, okay, so we have a blockage. This mechanical blockage occurs within the intestine. Bowel sounds are high-pitched. Non-mechanical peristalsis is impaired, so bowel sounds can be absent. So this is why we always auscultate. If you do not hear any bowel sounds, if they're absent, it could be a possible obstruction. You need to find out. Doesn't mean you should, it has to be other things involved. But this is what is happening. Intussusception and volvulus. So look at that. Okay, signs and symptoms: abdominal pain, blood and mucus per rectum, feces, flatus, fecal vomiting may occur, unpleasant, abdominal distension, fluid electrolyte imbalance, right? Okay, these are our tests that we can use. Therapeutic interventions, possible surgery, antibiotics, antiemetics, and analgesics. Always fluid and electrolyte replacement with any of these GI disorders. Acute pain, these are your nursing diagnosis. Dysfunctional GI motility, right? Okay, anorectal problems. We are on to page 678. Postoperative. This is what we would do. Pain control, sitz bath. That's for it's soothing. Dressing changes. We don't want an infection there in that area. Stool softeners, no straining. Causes. These are all the different causes. Lower GI bleeding continued. We will see occult blood, bright red stools. Okay, you want to monitor vital signs, shock signs. Colorectal cancer. Colorectal cancer is on page 679. Change in your bowel habits, abdominal. You can see there's very similar for all of these, so you have to see a specialist. Colonoscopy, biopsy. These are our tests that we're going to have, our diagnostic tests. Fecal occult blood. Therapeutic interventions. We're going to have a surgery, resectioning, radiation, possible chemotherapy, analgesics definitely for pain control, fever, possible infections, fear, imbalance. These are your nursing diagnosis, support and education, and postoperative care. You need to do good patient teaching. Ostomy management, surgical, created opening, divert. Okay, so let's make sure we stick with that here, which is going to be under 682 starting. Stoma is any opening to the body, so a portion of the bowel that's sutured onto the abdomen. Abdominal ostomies, there's some there. Ileostomy. Okay, just talks about the different. Here are the illustrations for that. So in A, we have a loop of terminal ileum. B, both limbs of the ileum are brought together and sutured into a U shape. C, the pouch is created in a nipple valve. And then D is the pouch sutured to the abdominal wall. So these are some of the corrections that can be made. Ileoanal anastomy, anastomosis, J pouch. Sorry about that. So that is something that has to be surgically put. They have to make that area so that it will be functioning. Here are the different types of stomas. Colostomy. Okay, colostomy is on page 683. Less fluid, less liquid, and more solid as location of ostomy becomes more distal. These are the different types of colostomies. There's here 3 different types. You can find those on page 683. We've talked about ostomy care, colostomy bags, those types of things. So this is all stuff that you are familiar with. So just review these. Skin integrity, skin irritation is a big concern for us as nurses. We want to make sure that you are paying attention and checking those sites on page 685, figure 34.9. There is a good illustration of images of stomas. Here it tells you the different status of stomas. We want to check vital signs and symptoms for infection always. What is the skin integrity? Okay, and we're down to the review questions. So I think that I am over my 15 minutes time. Start and stop these as you need to. Okay.